Yeah, Debbie took a little bit long because she was having a surface treatment, which is PRK.
Yeah.
He wanted us to repeat her maps, then he wanted us to do some measurements and stuff, so she took a little bit longer.
And I figured that's why, because on so much.
Oh, look, you can see the flap.
See, that's how
Yeah,
they.
you see it?
Yeah.
That's how they pried
See the
open.
ridge there?
Mm-hmm.
Dang, it's
And
trippy.
has she had now between here and here drops put in her eyes?
He put anesthetic drops before the treatment, and then they put more anesthetic drops before he puts a lid speculum on them. But you can see that the bubbles have most of them have gone away.
Most of them gone away.
Now what's that he's doing?
He's just marking the cornea, so when he lays the flap back down, it goes exactly where he wants it to be.
Oh, okay.
And that's an instrument to kind of separate the tissue, because even though it's imprinted, he still needs to do something to separate it.
Mm-hmm. Now that's the flap he's going to lift.
Correct.
Now what is that other flap underneath the, where it's holding the eyelid? It's like,
It's just a drape because there's some bacteria on the eyelid,
okay.
so it's just a tape.
Oh, there it goes, see?
And that's the flap.
Dang, it's
And now
trippy.
she's totally blind.
Vision is very blurry at this point, yes.
Now, here comes the
You can feel
basic.
pressure.
There it goes.
With the interlace pressure, but generally, some patients have said it's painful. I've never had the interlace done because I had the microkeratome. But the employees that have had it done said there's pressure, but it's not really pain.
Yeah.
So
What, on
some
this one?
patients no, on the interlace. Some patients express pain. Some patients just express pressure. So
You know what? I had it done, and the most pressure I felt was like someone was like pressing down on your hand.
And when I had it done, I felt not a thing.
yeah.
No
yeah.
pressure. Not a thing that I
It's
felt.
the
No
laser.
pressure or anything when I had it done.
Yeah.
She had a microkeratome.
And this part right here was a pretty cool light show.
And that's
Yeah, I remember.
it. Done with that.
Yeah.
Wow.
And my eye doctor said that when they put the flap down, he saw no bubbles. It was perfect. Perfection. Look at that. That's one eye done.
Sometimes when they put water around their eye, it kind of freaks them out, so they tend to look away.
Yeah.
And you'll notice we're looking at her upside down,
Yeah.
but the bottom part where you see a white opaque color on the colored part of her eye,
Yeah.
that's just basically an overaccumulation of bubbles,
Oh, okay.
and those will basically absorb and go away.
Look at that. You'd think that would, because she can't feel a thing. That is weird. One eye done.
She basically washes underneath, massages back down. Just goes around the flap, making sure that it's adhering to what's happening.
And it basically sticks to itself right away.
It starts healing immediately.
Yeah.
Well, they say the eye is the fastest healing part of the body.
Fastest healing parts of the body, yeah.
My son watched mine have been done. He said they nicked a blood vessel and it bled a little.
Yeah.
Scared him.
Sometimes with the cornea can get very vascular if somebody's worn contact lenses
And
for
I
a
did.
specific period of time.
Toric lenses and hard
Yeah.
lenses, yeah. Now what's he doing now? Just still
Just kind of, yeah.
Getting bubbles
just
out or
poking and
whatever.
prodding. Just making sure that it's adhering the way he wants it to.
Oh, she's getting so excited.
Now look underneath
She
the flap,
is.
getting rid of some of that moisture. Every surgeon has their own technique at this point. Some antibiotic drops.
And she looked up, down.
And
Well, you probably told her.
anti-inflammatory.
Ooh, that's milky. There we go, let go. Oh, I see what that thing was. Okay. One eye down.
One eye down.
Oh, the eyelids are taped shut.
We do tape them. What we used to do, we want the eye to stay moist.
Right.
And what we used to do is put a thick drop in that eye, but taping the eye down, they can't blink, so it's actually
Probably better.
better for them. You'll notice a little bit more blood vessels on the left eye, and I'm going to say that he might have had to do the suction ring more than once, so she'll have a little bit more redness.
I saw redness at the
Yeah.
top of it,
Right.
I believe, yeah. Very red. There, see
Right
that big
there.
one?
Yeah.
Ooh.
And it's basically just caused by the pressure. Like, I hate
Well, circular.
Yeah, and that'll go away over a period of time.
Yeah.
She has very pretty eyes too.
And you'll notice the bubbles again are pretty much completely gone. But the
Yeah.
remnants of the flap is still there.
That is so trippy.
She's got a good steady hand.
Yeah. She'll watch it, she'll be like, oh my goodness. She'll probably like, not watch it, she has a weak stomach.
Oh. Kind of looks like it's sticking. There it
Oops.
went. Oop. Look at that.
That's amazing.
Who would have thought the cornea looks like that? And then you hear the zap, 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 and you can smell it burning? At least I did.
Yeah, yes.
Still? Okay.
And there's a laser.
Here.
Yeah.
How can you tell when enough's enough?
They programmed her measurements into the computer,
Okay.
So the computer decides enough is enough.
and that's it gives you, like, for her prescription, for her age,
Yeah.
corneal thickness, they should treat this amount, and it'll take this many seconds to treat that
Yeah.
amount.
And that purple marking just washes away?
Yeah, it's like a skin marker. If you were to get, any type of surgical procedure on your body, they
Oh,
would
yeah.
mark you with the
Yeah.
same type of marker. It's a sterile marker.
Now, she moved her eye after he did that. Did he tell her to, or?
No,
Okay.
she, again, with the water, sometimes it freaks them out because they're
Oh,
basically,
okay.
Yeah.
drowning their eye with water,
Yeah.
with water. So, patients sometimes tend to twitch a little bit.
Wow. Done. Is she supposed to come back here tomorrow? Do you know?
Either here or with her optometrist.
Okay, that's what I thought.
I think she's coming here because we anticipated PRK.
Right, and she was supposed to come back tomorrow morning at 9:30, but if she can go to her,
Well, you can ask her. If she wants to go to her eye doctor, we can call them.
yeah.
And you'll notice there was something underneath, so he just washed it again. So now
Oh.
he's massaging it back again. What this laser has that a lot of the other lasers don't have, it's actually a newer technology, is this this bright light is a slit lamp. So like if they were to take him to the microscope, that's what he looks in their eyes with. And this makes it easier for the doctor to magnify and look under the flap to make sure there's nothing
Oh, I see.
underneath, as opposed to taking the patient over there.
Yeah.
And if there is something, then bringing them back over here.
Oh, yeah, yeah.
So it allows it to be done
Mhm.
at one time.
Now, your son, is he gonna have the -11 eye will be perfect or not?
There's no way.
How
It's
good will it
it's
get?
congenital. Good enough to help the other one.
But I mean, so
Yeah,
the other
one
eye
one's
can,
weaker than the other, right?
Quite a bit weaker.
but the other eye can be perfect. It
Yes,
go,
it can.
But now you
Right.
think, what if the other one's gonna go like a -4, -3?
No, our goal is to treat 100%.
Well, it's a genetic defect. It's
Right, but with his other eye, the
Yeah,
one that's
but-
correctable,
Yeah.
our
It
goal is
should
to
be
treat
fine.
him 100%.
Yeah.
Right, okay.
With the amount of prescription, he may get to 70%, so in 3 to 6 months we may need to touch it up a little bit,
That's what I was wondering.
or he can make it to 20%, 100%.
Oh, he's gonna be amazed. He's gonna be
He's going to be
amazed.
very happy.
Because I saw his glasses when he was in and I thought, oh, those are the kind I used to wear.
We had another patient, the second one today that has a very high prescription.
Yeah.
Well, that's the people that choose to do it, even in black and white.
Yeah, but you know what's interesting is, I do pre-post